From time to time, we have questions, and who do we ask? We ask Malcolm why. Why do things happen this way, Malcolm? Of course, he's actually Malcolm Fleschner, columnist in the San Francisco area. Malcolm, welcome back to the Young Turks. How are you?
Cenk, I'm delighted to be here.
All right, it's great to have you as usual. Now, we're going to talk about healthcare reform a little bit today, and earlier in the program we talked about the opt-out option. That's one of the compromises that's being considered, but the trigger is also being considered. That's brought up by Olympia Snowe of Maine. She's a Republican from there, and it's got some momentum behind it. I personally don't favor it because I think that it's a way of kicking the can down the road, but apparently you see some advantages in the trigger.
That's right, Cenk. And a part of it is about branding, because most Americans don't understand the healthcare debate and have no idea what the public option is all about. Most of us hear public option and think it means that if we get sick, we're supposed to take the bus to the hospital. But a trigger, now you're speaking our language, especially when it comes to our health. We hear the words trigger option and we say, please don't shoot, I don't have any health insurance.
Yeah, I don't think the word trigger has anything to do with it, Malcolm. That's not part of the healthcare reform at all.
Well, but a trigger still shows you mean business. And Americans are understandably worried about what's going to happen if they get sick. And nothing makes us Americans feel healthier, more powerful, and more alive than when we have our finger on a trigger.
Yeah, but look, Malcolm, what you're not getting is that it's weak sauce, and it just benefits the insurance industry, and it's not really reform at all. So,
well, but what you don't understand, Cenk, is that for politicians, there are a lot of benefits. In many ways, it's the perfect solution. Because by passing a bill with the trigger option, Congress can go to the American people and say, don't worry, we're doing something about this problem. Then they can turn around and go to the insurance companies and say, don't worry, we're not doing anything about this problem. It's what you call a win-win. Unless you count the public.
Right. Now, theoretically, in a democracy, it would have trouble passing without a public support, though. How do you get beyond that?
Well, that's true, but there is a lot of enthusiasm for the trigger option in other sectors, like Wall Street, for example. They love the idea of a trigger. So if this passes, they think they can go to Congress and say, essentially, instead of more government regulation, let's go with a trigger option. Yes, because of our greed and duplicity, the world economy almost went down the toilet. Our bad. But instead of a lot of pesky new rules, let's set up a trigger. And if at some point in the future we cause another financial crisis that drives the global economic system to the brink of collapse again, requiring trillions more dollars in bailouts from taxpayers, well, then maybe we can think about some minor tweaks to the system.
You know, Malcolm, that actually scares me. I'm not kidding around with you, okay? Because now you're introducing the idea of the trigger for other industries. And I think they're going to take that seriously.
That's what makes it so popular. It doesn't even have to be just limited to government legislation. The trigger option has all kinds of applications. So let's say you're Olympia Snowe's husband, and like so many other Republican men, you like to cat around a bit. So she catches you in bed with another woman for the 100th time, and she finally puts down her foot and says, that's it. She demands that the two of you go to marriage counseling, that you start attending Sexaholics Anonymous meetings, and that you wear an electronic ankle monitor so she knows where you are at all times. But you don't want to do any of that, so what's the solution? Trigger option. You say, honey, yes, there is a problem here. Mistakes were made. I'll tell you what, I will do my level best to stop sleeping with everything in a skirt that I can grab hold of. Then if at some point, 5 or 10 years in the future, you catch me again, well, that'll be our trigger to maybe look into this whole counseling thing.
Look, you know what? That's an awesome idea. I love the idea of, you know what, in my personal life, I'm going to go with a trigger. I'll fix what I'm doing wrong 5 years from now. But here's the downside. Do you think she's going to go for that?
How can she not? He can just tell her that if she thought the trigger option was good enough to entrust something as important as the health of millions of Americans to, it should be good enough for a little thing like their marriage.
Right. Look, I think that the triggered option doesn't even have really support from the Republican voters either. So, again, that's another issue, it appears.
Well, that's true. And that's actually exactly why many Democrats, who, as we know, are really committed to bipartisanship, are working on a new wrinkle to the trigger option in the hopes that they can get more Republicans to sign on.
Okay, I'm afraid to ask. What's the new wrinkle?
Well, it's a sort of trigger option for the trigger option. So according to this plan, if insurance rates don't come down in 5 years, then that will be the trigger that triggers the trigger option to go into effect, meaning that if nothing changes again 5, 10, 15 years after that, then we revisit the issue.
So the bottom line is nothing passes now, and we just wait again, and you get no change in healthcare.
Well, actually, no, there will be real changes, actually, because the insurance companies figure that if the trigger option is so great for healthcare policy, then it should work for providing the actual healthcare itself, too. So let's say you're diagnosed with a brain tumor. With a trigger-based healthcare approach, your doctor will note the diagnosis, tell you to check back in about 5 years. Hopefully, by then the tumor will have gone away on its own. But if not, and by some miracle you're still around, well, then your insurance company will consider letting your doctor treat you. It's a real money saver.
Man, I'm telling you, man, these are dangerous ideas. Don't think they won't do it. But
Well, you think this is bad, Jake. If the insurance companies had their way, they'd institute a different medical care trigger option. The kind of trigger option they use for treating a racehorse with a broken leg, if you know what I mean.
yeah, I guess we can be thankful they're not going to go in that direction. But I'm telling you, Malcolm, those couple of ideas, the trigger of the trigger, the applying the trigger to Wall Street and other things, and the trigger in real life, they're going to do it, man. You're giving them
It's
back.
about creativity and coming up with solutions that the people who matter can, get behind.
And then the healthcare, actual triggers for healthcare. You get a tumor, I'll treat you in 5 years. I'm telling you, these are genius ideas, and I'm afraid that we've done some great damage by doing this segment. Okay, Malcolm Fleschner, thanks for joining us as usual, man.